For over 20 years, the husband and wife team of Dr. Juan Fuello and Dr. Cande Gomez has searched for a cure for glioblastoma, the most deadly form of brain cancer. When a clinical trial testing one of their new therapies began 3 years ago at MD Anderson Cancer Center, many patients jumped at the chance to participate. Not surprising, since the average survival time after diagnosis of glioblastoma is only 9 to 18 months.
The cancer that I have is very aggressive, and so your view is that you're lucky to live another year, and at some point you're willing to try just about anything, and if it doesn't help me, hopefully it'll help someone else.
Mine was stage 4, the most aggressive brain tumor. I went into this thinking there's no cure, so if I had to take a chance, I told them throw anything at it they could.
Well, I was shocked, but also when my kids asked me, what are you going to do now? I said, I believe in God and miracles, and I'm going to fight it.
Doctors Fuello and Gomez had taken a common cold virus and altered its DNA to enable it to destroy brain tumor cells without affecting healthy cells. Dr. Frederick Lang, an MD Anderson neurosurgeon, did the initial testing of the virus, known as Delta 24, and then brought it into clinical trials.
The virus seems to activate the immune system while also killing the tumor.
During the trial, Dr. Lang surgically injected the virus through the skull directly into the patient's brain tumor. As more and more patients were treated with a single shot of the virus, doctors began seeing remarkable results. In 3 out of 25 patients, tumors were completely eradicated.
It was just slowly smaller and smaller and smaller. I've made it a little over 2 years, and it's been quite incredible.
After time, it started shrinking, and it's got down to the point where it's virtually not there.
The tumor started shrinking a little at a time, and then finally it was the diagnosis of, you've been cured.
We think the 3 people responded because of something special about their immune system. And this has really opened up an entire new avenue of research.
The results were unlike any the researchers have ever seen. But the question remains, why does the virus work in some people and not in others? One patient who had only a limited response to Delta 24 was James Broach, an athlete during college, a husband and father of 3, and a successful venture capitalist who was stricken with glioblastoma at age 35.
I think he readily accepted his diagnosis pretty early on. You know, a lot of people in those circumstances would ask, why me, or why my family, or why is this happening to me? And he never once asked that. He knew eventually he was going to die, and I think he wanted to somehow leave a mark, do something positive to help others.
James wasted little time after his diagnosis. Early on, he turned his focus and energies to finding a cure. He and his wife Jamie started the Broach Foundation for Brain Cancer Research. Now in its 3rd year, the foundation has given over $1.7 million to support brain cancer research at MD Anderson. By the end of the year, they will surpass the $2 million mark.
I don't need to emphasize how difficult glioblastoma is as a disease, as an impact it has on patients, on families, on the entire medical community. It's a very difficult problem, and it's not going to be solved overnight. It clearly requires fundamental research, and that costs a lot of money.
It's one of the deadliest cancers, it's one of the most underfunded cancers, and the research just can't happen quickly enough because research takes resources.
The Broach Foundation will fund future studies related to Delta 24, including a new way to deliver the virus that uses bone marrow stem cells to carry the virus to the tumor. This may allow for intravenous administration of the virus instead of injecting the virus surgically as is done now. The foundation is also supporting projects by other investigators, including one that studies a new gene that seems to drive the growth of brain tumors and may be a new target for drug development. A second project seeks to link the formation and growth of glioblastoma to cellular metabolism. These studies may lead to new ideas about how what we eat can influence brain tumors. After undergoing 7 surgeries and battling brain cancer for 3 years, James Broach lost his fight against glioblastoma. But James would be proud that his vision is taking shape.
He was one of the most humble people I know, but he was also very compassionate. He was caring, he was thoughtful. And from James, it came really from the heart, really from a true passion to want to make a difference and help people.
That difference already can be seen in the lives of those 3 glioblastoma patients who, because of Delta 24 trials, now have hope for living long lives.
It's been a life-changing ride, but you know, like I said, really blessed and really lucky to be here.
I feel good. New lease in life and get to be with family. It just feels really good.
Speechless in regards to how much it's done for me. It's a blessing to be awake each day. You could be gone any day.
Jamie Broach and the Broach Foundation are working to fund a diversity of research projects that will give hope to those afflicted with brain cancer. And Jamie wants her sons to be part of that, to continue with their father's vision of helping others.
I want the boys to develop a love for philanthropy. I want them to be able to think outside of themselves and look around and see a need in others and think of ways that they can help meet those needs.
The Broach Foundation has really been a remarkable organization. We really owe a lot to James, and his legacy is really the Broach Foundation. And hopefully someday we can cure brain tumors because of that legacy.
What James Broach has done to change the history of this disease is something that I am very proud to be associated with. James Broach has made a difference, and his life has meant a great deal to many patients that will follow.
I hope ultimately we in some way help to find a cure for brain cancer. I hope the research we fund can be the breakthrough that everyone's been waiting for that will ultimately lead to a cure.
And that's exactly what James Broach would have wanted.